All right. Well, welcome everybody. Get settled in. We have 88 people and counting, so we're just waiting like a minute to get people in the door so you don't miss anything good. But we're recording it in case you do.
And it's going to be on YouTube, right?
Yeah. And this recording will live on the YouTube channel. Yeah. Once our incoming participants start flattening out a little bit, I think we can go ahead and get started. Yeah. Okay. Well, why don't we get going? Well, welcome everybody. We're so glad you've been able to make it to the live show here. It's our documentary roundtable following having shared the link to our community on the documentary that Dr. Bredesen is featured in called Memories for Life. So we're hoping that you got a chance to see it, and might be that's why you're here, to talk about it, your impressions and questions that might have come up, and that's what we're here for. We have this great panel to answer questions today. My chances are we're not going to get to all of them, but we will be saving the recording, including the Q&A and the questions that come in, to be able to answer them potentially at a later date if we don't get to them all. And I'm going to have everyone introduce themselves. My name is Chris Coward. I'm the VP of Coaching Services for Apollo Health. And we will start with you, Dr. Dale Bredesen. You want to just say a few words?
Yeah. Hi, Dale Bredesen, neurologist and neuroscientist, very interested in neurodegeneration.
Excellent. Welcome. And Dr. Howard Hinden?
I'm a dentist for over 50 years, and I've been doing functional dentistry, working with a lot of the functional medicine doctors, and I am so excited to be working with Dale Bredesen and the Apollo team.
Excellent. Welcome. And Coach Julie Luby?
Hi, I'm Julie Luby. I'm really grateful to be here. I am a coach in the ReCODE program for people who are either preventing or reversing cognitive decline. I also lead some of Apollo Health's support sessions for people who are care partners or people who have type 3. And I've been coaching in this program for about 5 years.
Welcome, Julie. Glad to have you. And last but not least, our honorary doctor, Julie Gregory.
Hardly.
You should be.
Hi, everybody. I'm excited to be here. I'm the Chief Health Liaison here at Apollo. I help create educational material for our community along with our medical team. I'm also the founder and president of apoe4.info. And I come to this field very honestly because 11 years ago, I learned I carried 2 copies of the ApoE4 allele, putting me at very high risk for Alzheimer's disease. And I was experiencing symptoms at the time. I consulted with my neurologist, and the best he had to offer at that time was good luck with that. And I have been fighting ever since to save my life, and I've restored my cognition. I met the amazing Dr. Dale Bredesen along the way, and I'm thrilled to be here with everyone today to talk about this film.
Yeah, welcome. You're a big, important part of our time here. So just a reminder, or maybe I haven't said this at all, if you are here and have questions, please type them in the Q&A, and hopefully you can access that feature on your Zoom, and we'll be looking out for that, and we'll send the questions over to the best person, on our panel to answer. I can kick us off with one question that we received earlier, if you're ready, Dr. Bredesen.
Yeah.
And it's from someone from Cynthia Marsh, who asked, said the participants in the clinical trial appeared to have fairly high MoCA scores at the beginning of the trial. Is this correct? And would these participants be described as having early stage MCI? And are there other studies planned with participants who are more advanced MCI or early stage Alzheimer's?
Yeah, that's such a good point, Cynthia. So thank you for mentioning it. So when you develop Alzheimer's, you go through 4 phases. There's an asymptomatic phase where you can already show changes in p-tau, for example, and changes in in PET scanning, and changes in spinal fluid analysis. Then you go through the second phase, which is SCI, subjective cognitive impairment, where you're still scoring normally. So you'd be still 28, 29, 30 would be typical on the MoCA scores. The third of 4 phases then is MCI, mild cognitive impairment. And typically those people score anywhere from 27, although it's claimed 27 can be normal for some people. Most of us would get 28, 29, or 30. So this goes down to right around 20. Now there's a region 19 to 22, which is overlapping between the 4th phase, dementia, and MCI. The 4th and final phase is dementia, of course, and that's where you actually have activities of daily living that are beginning to be lost. So when we set up the trial, well, actually we set it up to be very similar to the drug trials. These are MCI and early dementia, so 3rd and early 4th phases. In our trial that you mentioned, we went down to MoCAs of 19. The new trial we've just started goes down to MoCAs of 18. And we saw a couple of people go from 19 to perfect 30. So just striking improvements, whereas others only, for example, from 22 to 24, that sort of thing. So it depends on what's causing the problem, et cetera. So these are MCI and early dementia patients, very much like, for example, the lecanemab study that also looked at MCI and early dementia, where they just saw a slight slowing of decline. We actually saw improvements. So these are people that are actually fairly far along, but as you indicate, you can go farther with the teens, even down to 0. So we do see improvements in people, even at 0 sometimes. But you're right in that as you get farther and farther along, it is harder and harder. You have to do more and more, which is why we encourage everyone, please, if you are 40 years of age or over, please get a cognoscopy. Please get on active prevention or earliest treatment. SCI responds pretty much 100% of the time. So if we would all do those 2 things, prevention or earliest reversal, dementia would truly be rare.
Thank you. So this question came in and Lance answered it behind the scenes, but I'm sure as people roll in, we're going to get it again. So I'll just say, so the movie, we had a private showing via watching it on your own. And it's going to come out to the whole public on November 15th, and it'll be able to be streamed on Amazon Prime and Apple TV. There might be some additional streaming services too, but those are the ones we know right now. So if you missed it, don't worry. It'll be out there for everybody on November 15th.
Yeah, and there's a website for that you can see this for Memories for Life. So it'll direct you to the right place to go to get this. I think it's also coming out on Vudu and Tubi, I think are the other ones. So it's just going to be a couple more weeks.
Excellent. Good. So our next question is from Guy, and he says, I have FTD, and is the ReCODE program helpful?
Yeah, this is such a good question. FTD, much less common, frontotemporal dementia, much less common. It is a TDP, usually a TDP-43 apathy, as opposed to the A beta and the tau. And it is frontotemporal in nature, of course, as the name implies. We do not have nearly as much data. There have been a few reports of single people where this does seem to be helpful, but it's a different pathology. It's a different pathophysiology. So when we set this up, we developed this for Alzheimer's pathophysiology. We are now starting to adapt this for other pathophysiologies. And ALS is actually a cousin of frontotemporal dementia because they are both TDP-43 apathies, as is a third one, which is called late, which is an Alzheimer-like dementia that's typically in people in their 80s and 90s. So time will tell. We need more work on this. We are opening and establishing the first precision medicine program for all neurodegenerative diseases, which is at the Pacific Neuroscience Institute in Santa Monica, should be opening in the first of the year. So we hope to get more experience with this. But I have to say, as of today, we can say we have very good results in many people who have Alzheimer's, especially in the earlier stages. We do not have those same data for FTD patients yet.
Yeah, and just as an extension of that question, Wendy's asking, does this help Parkinson's?
So Parkinson's, again, there's another adaptation. The good news with Parkinson's, We understand that one better in that it is typically a toxin-related problem. It is typically a mitochondriopathy. Complex 1 inhibition leads to Parkinson's. And so when we do have good results with people with Lewy body disease, as long as you look into their toxins, and there's a nice book on this, A Prescription for Ending Parkinson's. This is from Dorsey and his colleagues out of University of Rochester, and I recommend that book wholeheartedly. And they talk about the many different organic toxins that are associated. So if you do have Parkinson's, please get evaluated and please make sure that they look at organic toxins, inorganic toxins, and biotoxins. One of the points made by Dr. Richie Shoemaker is that with people who are exposed to mycotoxins from molds, Parkinson's is one of the things that they can get. So please link with a practitioner who is familiar with toxicity.
Great, great. So Dr. Audrey her question is regarding the ketogenic diet. She hasn't heard anything about the importance of checking the ingredients in the food products, that is sugar, et cetera, filler ingredients like cornstarch, or organic versus not organic. And I'll direct this to Julie G, if you want to take this one on.
That is a great question. I think why you're not hearing a lot about it from us is that before you begin the diet, we ask people to give up all forms of sugar. And the diet is essentially a whole foods diet, so we don't need to check the ingredients. You make a really good point, though. We don't want you to ever be using cornstarch that isn't organic, because it is likely GMO otherwise. So, and we also would recommend alternatives to cornstarch like arrowroot powder or xanthan gum or other things to use as a thickener. But that's a terrific question, Kathy.
Yeah, and we'll stick with you, Julie G, because Kathy, a different person, is asking, movie was great. She's been following Dr. Bredesen, APOE44 for many years, which means following you, I think. And have you ever heard of people getting severe diarrhea for months on the KetoFlex diet? I did the diet and many supplements, was good for a couple months, then had to stop due to severe diarrhea. I did get a colonoscopy and diagnosed with lymphocytic colitis.
Right. Yeah. Sorry that's happened to you. You know, I wonder if you're working with a functional practitioner, because I'm suspicious that there might be some SIBO, small intestinal bacterial overgrowth going on. And that's something that a lot of mainstream GIs don't test for. So yes, I'm certain you have this other condition, but I wonder if there's a SIBO going on. There's also digestive enzymes you can be doing to help with fat, like ox bile. Digestive enzymes with lipase can help you absorb dietary fat. But for now, you know, certainly follow whatever diet your physicians are recommending. Another thing to look into is rule out food sensitivities that could be causing the diarrhea.
Yeah, great. This one's for you, Dr. Bredesen, from Carl. He's curious if you're familiar with Dr. Derek Lonsdale's work on thiamine deficiency from high calorie malnutrition. And if you are familiar, what are your thoughts?
Yeah, and certainly, I mean, thiamine deficiency has been known for over 100 years as being a major player in memory loss. So the so-called Wernicke-Korsakoff syndrome, which we used to see patients in the emergency room with at times, from thiamine deficiency. And the thing that it hits is your memory consolidation. So you have trouble with forming new memories. So that's always a concern when people have an amnestic presentation for Alzheimer's, and we always make sure that they have appropriate amounts of thiamine. You only have about 2 weeks of stores of thiamine, so it's relatively easy to be low in your thiamine. So yes, but again, going back to, Julie's point about a whole foods plant-based diet, plant-rich diet, which we use for KetoFlex 12.3, this should not be a problem for the vast, vast majority of people.
I'm noticing, it's interesting as I'm scanning these questions, that these questions are pretty technical and showing people have some advanced knowledge in these things. I was expecting things like, what is Ketoflex 12.3? But like, all right, we're going deep. So this question is from Danielle. Have you worked with any Black people in your studies? I've only seen white and Asian. I wonder how these treatments work on other demographics. And thank you for what you're doing.
Yeah, it's a great point. And I've actually talked to Asaniti Foster, who is an African-American filmmaker who's doing her own filming and work on Alzheimer's and what it means for the, many families. It's a very good point. And the first places we simply went with who are the practitioners that have the most experience with this, that are getting good results, that know how to do this. And that time it was Dr. Gordon, Dr. Anne Hathaway, and Dr. Kat Toops. And so that you're right, that first trial did not have African Americans. We've tried to improve with diversity on the second trial. So we now have 6 sites. We have Southern Florida, we have Nashville, we have Cleveland, Ohio, we have Sacramento, we have the East Bay, and then we have San Rafael. So hopefully we will do better with diversity. It's a very fair question though, because there are differences, for example, with some of the ApoE4 effects. That can be different, especially in Africans, not African Americans, but in Africans, there are differences. So we hope that the biochemistry and the genetics that we've discovered and that have been useful so far will continue to be useful. And certainly out of the over 7,000 people who have come through Apollo, there is some diversity there. But you're absolutely right. There wasn't a diversity in that first trial. It was whoever came in and whoever responded to the advertisement. So I'm hoping that with where we're doing the second one of the 6 sites, we will do better with our diversity in the second time around.
Great, thank you. There's a couple questions about some aspects of the protocol, and one is around exercise and EWAT. And EWAT is exercise with oxygen therapy. And someone wants to know, like, do we have a recommendation around frequency and duration, and also a minimum level needed to get benefit?
Yeah, it's a great point. So when the big issue with Alzheimer's is this combination of energetic insufficiency and demand increase, which is typically inflammation. So it's too much inflammation and or too little energetics. And so exercise, Katsu bands that Julie has talked about before on some of the Facebook Lives and things like that, very helpful. Getting out there, both aerobic and strength training by different and complementary mechanisms are very helpful. Of course, there was the recent study that people heard about with Viagra. You're improving blood flow to the brain. So all of these things are helpful. I like EWAT a lot because it combines this idea of increasing the blood flow and at the same time improving the oxygen. And we've had some people where really wonderful responses to that. Now, just was in a few minutes ago in another Zoom where we were talking about, well, dropping this. And I know that LiveO2, for example, likes to go from hyperoxia to hypoxia, which is great if you're training for the Olympics or something, and great if you're training, for cycling in the hills. But I do worry about too much hypoxia for anyone who actually has cognitive decline. We really want to focus on the increasing blood flow and the increasing oxygen. You'll get a relative hypoxia just coming back to room air. That will be a relative hypoxia. So I don't want to drive people too low. We want to get this increase. Now, as far as how often to do it and how long, typically what happens is, you fill up the oxygen bladder basically, and it's about 20 minutes of exercise. That's about what you can do. And if you can do that 3 or 4 times a week, that would be great. And some people will do more, some people will do a little less, but that's a good target to go for. And that has, for many people, been very, very helpful. So I would be careful, and if you're going to do too much hypoxia, talk to your practitioner. I would even talk to the people, whether it's LiveO2 or whether it's MaxO2 or whether another group, about dropping it too low and see how you respond to it. Because hypoxia is one of the things that during anesthesia actually contributes to cognitive decline. So please be careful on that side of the EWAT.
So
Great.
can I add something?
Yeah.
I have a LiveO2 system in my office for 6
Great.
years. 6 years.
Great.
I bike at the end of the day, 20 to 30 minutes at 90% oxygen. And all the aches and pains that I have from sitting around and not getting enough movement, working on patients are gone. And I have extra mass. And if any patient wants to come and try it out, I just turn on and fill up the balloon and let them come and try it out. I think it's a wonderful thing. And I agree that if you're training for an Olympics or something, you want to train at low oxygen and high oxygen, but that's not what the goal is. You just do it at 90% oxygen, 20, 30 minutes, and that's fine. I sit and I write up my charts and I get the benefits of the oxygen.
Great.
So, Dr. Hinden, since you're on the mic right now, I suspect there's a lot of people on this call that don't really recognize the importance of oral health and the connection to cognition. Can you say just a little bit about that?
Sure, but I looked at the participants. I know there are some people, there are a couple of my patients, and there are a group of health,
So they know.
from, a couple of health coaches from Show Up Again Naturally. So I know they know, but I've been as I said, I've been working with functional medicine doctors right next door to my office for 30 years. Was Michael Schachter, who was one of the leading complementary cancer doctors. And anybody he was treating for cancer had to have an oral exam, had to look for infections, presence of mercury or nickel or other toxins, periodontal pathogens, which is the same thing that are part of the ReCODE program. So whether it was neurological things or cancer, that's my background in doing that. What I like about the ReCODE program is you're always looking for what's the missing piece, what don't you have in the puzzle. And I was thinking about that. It's like this program on TV called Chopped, the cooking show, where everybody gets the same ingredients, but not everybody comes up with the same finished product. And so a lot of it say, well, I read Dale Bredesen's book, I can do this, I can change my diet, but it's not the same thing as having a coach doing this. And if you're beginning to be in the early stages and you know where it's going to lead, why would you not get the best program you could possibly have? You know, it's like, yeah, you can cook at home, but sometimes you really want to go to a good restaurant.
Mm-hmm. Yeah.
And I should add that in our trial, and both the trial that we published and the trial that we have just started, we are absolutely including dentists and looking at oral systemic care. It's a very common, you could argue it's probably the most important area of the body when it comes to cognitive decline. The issue of toxicity, there's the issue of hypoxia and the issue of sleep apnea. There's the issue of the oral microbiome. If you actually look at the plaques in the brain in Alzheimer's, what do you find in them? You find oral bacteria like P. gingivalis and T. denticola and things like that. But you also find things like candida and fungi and things like that. So it's very clear that this is a response. This is an immunological response, part of the innate immune system responding to these various insults, many of which, and I should add herpes simplex, another one. So we actually do include cone CTs looking at are there any infections and so-called cone beam analysis on all these patients. And we do find people who have undiagnosed oral health problems that are critical and are the reason that they're having cognitive decline.
Yeah, I just want to go back for a minute when you were talking about thiamine deficiencies. So it's really interesting that one of the places where that shows up very readily is in the oral cavity, inflamed mucosa, angular chelation, where the corners of the mouth crack, burning tongue. So these are things where, in the absence of any oral problems like plaque, we look for vitamin deficiency. And I would say anybody who's a dentist or works in the dental arena who sees this, maybe you should ask a question about, are you having any problem with memory? Because that could be a thiamine deficiency. And even though we don't think about it, it's much more prevalent than people know.
Yeah, I'm going to zoom out for a second and answer. So Mary asked two questions, and I'm going to throw this to Coach Julie Luby. One is, and one's probably quicker than the other. One is about the use of V-Light, and is it V-Light or Vi-Light? V-Light, right? Yeah. And then the other one is just some basic steps. This is someone who's probably looking to be a member and wondering like just how to get started. She lives alone and is just curious about the support part of it, and how to find a doctor and all those good things, like kind of like becoming involved 101. So I'll throw that to you, Julie.
Sure, that's a great question. I'll start with the how to become involved and how do you get started with the program. I think the easiest thing to do is to go onto the Apollo website, and when you sign up, you will also sign up to have the blood work done. And you can do that, make arrangements right through the Apollo site to have the blood drawn at Quest Labs. And your lab work will be completed. The results will be uploaded into your ReCODE report. The piece that you have to do is you have to fill out about 75 health history questions. So the combination of your blood work and the results of your health history questions will then generate your ReCODE report. And I really recommend people doing that, especially if you're just starting out fresh. Do that even before you select a practitioner, because the results of your ReCODE report will tell you what your biggest risk factors are for cognitive decline. It's a personalized report. It gives you the specifics in the order that these 6 areas are a problem for you. Knowing that information, my next recommendation would be to get in touch with the Apollo support team, because they know all the practitioners in the database. So they're very familiar with it. So if you look at your report and it says that toxins are in your top 3, or maybe you see that you need help with hormone therapy, or anything that requires a prescription, you want to know those things ahead of picking a doctor, because what we'll find is there are some doctors who are comfortable with dealing with toxins and some who are less comfortable. So if that's one of your top 3, it'd be best to choose a doctor who not necessarily specializes in it, but is comfortable treating that. So the combination of your report already generated and the wisdom and knowledge of the support team can really help you to zero in on a practitioner that's right for you. You can also find health coaches this way. They can help you find the appropriate people. And don't forget that practitioners don't have to be in your hometown. It's great if you find one that is. Some of them do telehealth, and some of them are licensed for practicing in different states. And again, the Apollo support team knows all that information and can help you with that. So hopefully that answers that question about how to get started. I don't know if there was also sort of a question about what kind of support do you get, but there are lots of different options for being supported through this process. There is a forum for participants. So going online on the Apollo site, you can post questions, you can read other people's questions and join the conversation. People share all the time what they're doing, what their best practices are. You can ask, if you've got a question, somebody in the community probably has had that experience and can share their experience with you. And then also there are some support groups. Like I mentioned, I lead some of the support groups. So that's another great way to get some support, especially if you live alone. There's ReCODE support groups that just work with people who are trying to do the ReCODE program. There's a pre-code support group. There are care partner support groups. There's support groups for people who are type 3, which is toxic, so have some sort of toxic risk factor. And then there's also some courses that you can take, some educational pieces, which are, there's one on mastering keto flex, which is really popular, and it can be really helpful in helping you make changes in your diet. And there's one on mastering mold, if that happens to be one of your problems. So those are all pieces of the Apollo ecosystem that can help you out and support you. And then I think the other question was on the V-Lite. Is that right?
Yeah, do we recommend that as a tool?
Yeah, that's certainly a tool that falls under the brain stimulation strategy of the B7, we call them. It's stimulating your brain through light. I don't know a lot of the technical parts of it, and maybe Dr. Bredesen knows more about that, but just in my experience as a coach, I know that some of my clients have used that and have tried it. Some people have gotten what they think are noticeable results in either themselves or their loved one. And I will be honest, some people haven't felt they've gotten results. I think the people who have found it to be helpful do it regularly. And a couple have also told me that if they stop doing it, they notice that they sort of decline. So I think it's a technology and a modality maybe that help some people at least. And it may even be a process of tuning in. I know some have worked directly with the company to make different settings and things like that. So I would encourage you, if you decide to try it, to work with the company that makes the V-Lite, because I think they can help you tune in the device if it's not working for you right away. And I don't know if anybody else wants to share more about that. I'm probably not an expert.
Julie, you mentioned a little bit about, how does it work, et cetera. So I just want to say that everything we do has only one goal: best outcomes. So if we're working with someone, it's because we think it'll help our outcome. If we're not working with someone, it's because we don't think, or we don't know about it maybe yet, but or we don't think it is helping best outcomes. So that's the only goal here. How can we get the best outcomes for everybody? With the V-Lite, and also we've worked with Neuronic. These are devices that have been shown and published data to improve. However, as Julie mentioned, some people are helped, some people are not, and it depends on what your rate limiting step is. If you just take someone who has nothing else and just get stimulation, and I just heard another one of these today, where someone's saying, oh, this is the way that you're going to cure dementia. No, this is part of an overall protocol. And so you're having this stimulation, and the stimulation is such that it is giving light at the level that cytochrome C absorbs. That's been thought to be, for years, to be the mechanism of photobiomodulation that seems to be helpful. So you are helping essentially your energetics through this interaction with cytochrome C. And of course, there may be other effects as well. But certainly V-Lite has published data showing improvement in cognition. And Neuronic has published some as well. So try it. And we've heard some people where they'll say, wow, it really helped when I used it. And as Julie said, other people, it doesn't seem. And those people, of course, that's not your rate limiting step. It may be other inflammation. It may be something else, toxin exposure, whatever. So for some people, it will be very helpful.
Yeah, great. So I got a couple questions for Julie G that came in. One is from Kathy, who's thanking you for, because in your group you mentioned that, as much as you love the movie, the juicing part was a little troubling, and she's just supporting that, that she's glad that you called that out. And then Sarah is asking, when's the vegan diet going to be available on the meal plan?
Oh, yeah. So I want to say something quickly about both of those.
Yeah.
It's wonderful that juicing helped Deborah in the movie. And certainly it is a huge improvement from the standard American diet. But we're not huge fans of juicing for several reasons. One, it really can cause a glucose spike when you remove all the fiber from fruits and vegetables. And if you are juicing now, you can continue juicing, but that beautiful pulp that you're collecting in the back end of your juicer, add it back in, because we are huge fans of veggie smoothies. So if you prefer to drink your meals, consider making veggie smoothies with like leafy greens and cucumbers and parsley and celery and lemon and ginger. They can be absolutely delicious. The fiber feeds the gut microbiome, which in turn supports the brain. So we find fiber incredibly important. And I'm glad you mentioned the Nutrition for Longevity meal kit. We're so excited to have recently partnered with them. Lots of people find the KetoFlex 12-3 diet pretty complicated at the beginning. We know nutrition is the most important strategy that people can use, but they have a hard time sourcing the proper ingredients and putting it all together. And so Nutrition for Longevity has done that. They've made it easy. There is currently a flexitarian diet, a pescatarian diet, and a pick your own. And if you do the pick your own, Kathy, there are many vegan options now. So at the beginning, we did not launch with a chef curated vegan diet, but you can put together your own vegan diet now. For anyone who's interested, you can go to ketoflex123.com to try one of the meal kits, and it'll help you get an idea of what a whole foods diet that's plant rich is all about. The food is absolutely delicious.
Yeah, thank you. So I'm going back to a much earlier question that we didn't get to from Brad. His wife was diagnosed with PPA, primary progressive aphasia, and he was watching the documentary, and he seen a connection with the PPA, and he lives in Austin, Texas. So he's asking, how do we connect and learn more about ReCODE in Austin, and how can we benefit as someone diagnosed with PPA?
Yeah, this is a really good point. So there are several different non-amnestic presentations. So there's about 2/3 of people with Alzheimer's will present with an amnestic presentation, problems with their memory. 1/3 will present with other things, and that's PPA, PCA, posterior cortical atrophy, where you have visual association and interpretation problems, dyscalculia, problems with agnosias, not knowing how to add, not knowing how to read, apraxias, not knowing how to dress, things like that. Any of these things are all in the non-amnestic presentations. Those are predominantly parietal lobe, whereas the amnestic ones are more temporal lobe. And so these are presentations of Alzheimer's. Now, it's important, specifically in PPA, that can be due to a couple of different things. So it's important to know, is this PPA due to Alzheimer's, or is this PPA due to frontotemporal dementia? There are different kinds of PPA. The one that's called logopenic PPA is typically Alzheimer's. The other ones are typically not Alzheimer's. And so it's important to know which of this, if this is Alzheimer-related PPA, and that is likely to be due then to various toxins. And we have had, by the way, people clearly getting better. Interestingly, that was one of the first ones I heard about with EWAT. One of the examples we had was someone who had a lot of exposure to paraffin candles and had high multiple toxins in her blood. So please look into that. Please make sure that you look at various toxin levels, find out if this is Alzheimer's or what have you. As far as Austin, yes, if you go to the Apollo Healthco .com website, or you can even go to any of the others, My Cognoscopy or any of these, that will get you to the same place. And look at practitioners in your area. And yeah, let's get you to someone, and let's get this treated, ASAP.
Oh, I was muted for a second because my dog was barking. So this is from PJ, just a question on, in finding the correct supplements, does Apollo look at nutritional response testing? Dr. F. Ulan, I think I'm saying that right, was the founder. Anyone want to hit that one?
I'm not familiar with this particular doctor.
Okay.
So again, I would say, everything we're doing is for best outcomes. We have, multiple published papers showing positive outcomes, a recent trial with positive outcomes, and then of course a follow-up trial from Dr. Heather Sanderson using the same approach. She got very similar results with improvements as well. And actually, our own Dr. Ram Rao was one of the co-authors on that paper. We're always looking at what's going to get best outcomes. So if there's something that should be added to improve that, hallelujah, please let us know.
Yeah, great. Someone is making comments, amazing how my elderly patients use the high protein drinks like Ensure. Is there an alternative?
Yeah, that's unfortunate because Ensure is sugar, vegetable oil, and a lot of things we don't want you to have. The alternative is to have healthy proteins. Once again, if you prefer to drink your proteins, the only protein supplement that we like is hemp powder, 100% hemp powder. And you can put that in your veggie or fruit smoothie. And it's much healthier for you than Ensure.
And Julie, could you say something about how to, if you're not going to do nose to tail eating, what's the best way to get all the different amino acids that you need?
That's a really good point. So if you tend to only eat muscle meats, which most people do, it's very rich in methionine. And so in order to balance that, it's a really good idea a couple times a week to have a cup of bone broth. It's got different amino acids. Also, consider having some liver, grass-fed liver, maybe once or twice a week. I buy a little liver pate that's fully cooked. And I just cut off a little slice and have a few discs a couple times a week. And it's a wonderful way to balance the different amino acids.
And do you like collagen protein?
There's pros and cons to that. If you're going to do it, it certainly has to be a super clean version. We prefer that they get their collagen from bone broth because it's ancestral. It's not as processed. So bone broth also is one of those things we don't want you to have every day because there's certain cautions that go along with that. So if you're going to do bone broth, consider it like 3 times a week. Consider adding some liver or other organ meats, and it's a wonderful way to make sure you're getting all the different amino acids.
Julie, if somebody was been on an Ensure diet for a length of time and decides to change to a more whole foods, might they have GI problems because their gut microbiome has to be reconfigured?
Absolutely. And so we encourage people to go slowly. We have a very plant-forward diet. We want folks to try to work up to 6 to 9 cups of non-starchy vegetables from every color of the rainbow. But depending on your starting place, you may have to start very slowly. And that's just fine. You can also use digestive enzymes. You can use bitter herbs. You can chew lemon peel and use lemon juice. There's lots of different things you can do, digestive aids, to help your stomach and your GI tract slowly acclimate to the increased veggies. But you're absolutely right, Dr. Hinton, that's an excellent point.
You also probably would add prebiotics and probiotics too.
Well, in our diet, the 3rd level of the brain food pyramid, Chris Coward,
Yes, here we go.
is
We have a
actually
visual aid.
focused, on optimizing gut health. And so the 3 foods that we're encouraging people to eat at this 3rd level are foods that are rich in prebiotic fiber. To some extent, all non-starchy vegetables have prebiotic fiber, but there's some veggies like artichoke hearts and jicama and asparagus that are very rich. We also want people to eat a small amount of resistant starches like legumes or colored tubers. And the reason we recommend a small amount is because they can spike your glucose. And finally, we do encourage folks to add a tablespoon or 2 of fermented food, which serves as our probiotics. But once again, this is something you need to start slowly and layer it as your stomach is able to handle it. Ideally, we want folks to eat about half their veggies raw and half cooked. But if your GI tract isn't used to a lot of vegetables, you may want to start with more cooked and then work your way up as you heal the gut and it becomes healthier to adding more raw vegetables as well.
that probably speaks to the importance of a health coach while you're going through those phases, because it's very turbulent waters.
We love
Yeah,
health
absolutely.
and nutritionists. Yeah,
Yeah, very helpful to make this all very doable. And just to plug, like that slide that we just showed is the foundation really for our Mastering Nutrition for Cognition education group that Coach Julie was referring to. Just helping people really walk through that systematically and in a way where they can integrate. So I got a couple questions for you, Dr. Hinden. One is, besides getting our teeth clean, are there oral rinses or other things we can do to destroy this bad bacteria?
Well, there's always going to be bacteria in the mouth, can never be bacteria free. So you want to encourage good bacteria to grow. And so, you know, they've done experiments where they've given people antibiotics to get rid of all the bad bacteria, all the bacteria. When it grows back, it always grows back the same population of bacteria that was there before, because the foundation isn't there. It's like if you have certain soil, certain things will grow. So one of the things you can do is you can check your pH. Ideally, the mouth should be slightly on the alkaline side. The bacteria that cause periodontal disease and tooth decay can only grow in an acid environment. And so what happens when you have more vegetables? You become more alkaline. What happens when you cut down sugar? You become more alkaline. So yes, you can do things in your mouth, but what you do to your body really affects your mouth. It's really a two-way street.
And Howard, could you add a discussion of comparison, for example, with something like dental sidin, where you're killing hopefully killing more of the bad guys than the good guys, versus something like a probiotic toothpaste where you're essentially trying to add the good guys? Could you talk a little bit about that?
So what we do with our periodontal patients, we want them to, we look at their diet, which is important. They have toothpaste that have probiotic toothpaste in them, which are good. I mentioned the other day that we one of our webinars, we had a doctor who's doing research with phytocannabinoids, and they have different mixture of the compounds that seem to kill the bad bacteria, but don't harm the good bacteria. So there's a lot of research, and even adding more fiber to the diet will promote a healthier microbiome, not only in the gut but in the mouth.
And the second question for you, Dr. Hinden, is someone's asking, should there be concern if I wear dentures?
Well, I think there should be a concern why you needed dentures in the first place, so that there were healthy people don't have dental disease and lose their teeth. But a couple of things, dentures can attract mold and yeast and candida, so you want to make sure that they're clean. And if in the testing it shows that you have an overgrowth of that, then you really want to clean your dentures. They have different things to clean them with. They have ultraviolet light that you can clean the dentures with. The other thing is often the height of the dentures. The teeth wear down, and when the teeth wear down, it makes the place for your tongue smaller, which can lead to airway and sleep problems. And so we have patients who have dentures, and we make them a second set of dentures that act as a sleep appliance at night. So it helps keep their oxygen. It prevents oxygen desaturation, which my friend Dale now knows is a very important thing.
Now knows, just today. So we have a question from Wynn. Does the condition of essential tremors lead to dementia?
It's essential tremor by itself is not something to worry about. It's typically pretty easily treated with things like propranolol. It's common. It's often familial. It may affect the voice as well as hands and things like that. So yes, when you have any sort of tremor, it is very important to understand what type of tremor this is, because the resting tremors, of course, are associated with Parkinsonism, whether it's Parkinson's disease, whether it's part of Lewy body, any of these. And by the way, we see increasing overlap between Lewy body and Alzheimer's as these new tests where you're now looking at alpha-synuclein, which collects both in Parkinson's and Lewy body and what's called MSA, multiple system atrophy. As people are starting to do these with Alzheimer's patients, they're finding many positives. So there are a lot of people who have Alzheimer's who have some degree of this synuclein, the Parkinson's associated one. So it's important to find out what kind of tremor you have. But if it's one of these benign essential tremors, that is not associated with cognitive decline.
Great, thank you. From Melody, she says, this is not uncommon. I have or can implement most of the items in the Bredesen protocol to hopefully not get the dementia my mother had. I worry about the fat required in the keto diet. I have both Hashimoto's and fatty liver. Is there a modification for people with these additional problems? Anybody?
That's a wonderful question, and I'm not a physician, so Dr. Bredesen, feel free to jump in. But my understanding is that our dietary approach will help to heal Hashimoto's and fatty liver. There's a misconception that fatty liver is caused by excess fat in the diet, but it's really caused by excess sugar and carbohydrates in the diet, which we limit. So our approach would be very helpful. As far as Hashimoto's, things like working on healing the gut, lowering inflammation, overall inflammation, taking out all inflammatory foods. It should be, I think the KetoFlex 12-3 approach would be very helpful. Do you want to add anything, Dr. Bredesen?
Yeah, good point. I would just say that for Hashimoto's, I think Mary Ackerley said it well. When someone comes to her and happens to have Hashimoto's, there is a gut problem until proven otherwise. So please get a serious evaluation of the gut. Make sure you don't have leaky gut, because that's one of the common contributors to Hashimoto's and inducers of Hashimoto's. And then look at other things you may do much better, for example, on some LDN, as an example. As far as liver, what you said, Julie, is absolutely true. This is more about sugar, but it's also about toxins. So whether you're exposed to ethanol as a toxin or whether you're exposed to other hepatotoxins, these can all lead to fatty liver, as can metabolic syndrome and the changes. So they've actually changed what used to be called NASH is now called MASH. What was a non-alcoholic steatohepatitis is now a metabolic steatohepatitis. So I think it's recognized increasingly that this is a common problem and is really associated with metabolism changes, not high-fat diets. And when we talk about high-fat diets, we're really talking about high good fats diets and with appropriate, with appropriate fiber, with appropriate levels of protein. And we were talking just a few minutes ago about spiking your sugar. So this kind of all fits together. We should mention CGM, continuous glucose monitoring, that's been so helpful for so many. And we see people both on the spiking side and on the trough side, where they go to bed at night because they've had a high carb diet. They now drop down and they wake up in the middle of the night, often sweaty, and they don't realize what it is. And it turns out their glucose is 45. So those are both bad for your cognition. And I think it's really helpful. We all should have a look at what's happening to our glucose at various times in the day, and some CGM would be helpful.
And if I could add, the other thing you might want to look at is there a sleep problem? Because sleep apnea and the other disorders on that continuum have been linked to non-alcoholic fatty liver disease and to Hashimoto's disease, which people who have a chronic problem tend to be hypervigilant and sympathetic upregulation. So it actually makes them a greater inflammatory response.
Great, thank you. This next question is for Coach Julie, because she has a lot of experience working with folks that are not in the U.S. And there's a question from Natalia, maybe. How could ReCODE be followed internationally where some tests might not be available and the interpretation of results difficult?
Yeah, which is a great question. And I will say that the landscape has changed a lot over the last 5 years that I've been coaching, certainly. A lot of the strategies of ReCODE can be done by yourself, optimizing your sleep, optimizing your diet, getting good exercise, brain training. Those are really all accessible to just about anybody who wants to try them using the resources on the Apollo site and other resources, and using Dr. Bredesen's book as your guide. As far as getting the labs done, I've got clients kind of all over, and they've had various experiences. I believe there is now a lab in the UK that will do the ReCODE panel of tests, and I think it's available to pretty much anyone in Europe. I don't know if it's accessible to people outside of Europe, but there may be a way to do that. I've also had some clients in Asia who have been able to find a functional medicine practitioner locally, maybe not ReCODE certified, but somebody who could help them get the testing that they needed. If your finances make it possible, I've had people visit the US and get the testing done, sort of a medical vacation in reverse, where they will come in and schedule all the testing and fly in and do it. Now, of course, that's pretty expensive, but it can be done if you're having difficulty getting your testing done, locally. But you'd be surprised, a lot of the testing can be done locally with the help of a doctor. And basically do what you can. I've also helped clients find functional medicine doctors in their country, work with the Apollo Health support team, because we have new doctors getting certified every day, and our doctors are becoming more international, as well as health coaches. We have health coaches in pretty much all parts of the world who are certified. We have Spanish speaking health coaches.
Yeah.
It's, if you let the support team know what you need, you can find somebody to help you. But again, if you become a member and you can access all the materials on the site, a lot of this can be done. I've also had, people who have toxins, they know this from their report. They need to do the next step of getting heavy metal testing or mold testing. Some of them have been able to order the kits to do like mold testing internationally. If you contact the testing companies, they are set up to ship internationally. If you're looking for supplements, my best experience has been with a company called Cytoplan in the UK, and I know they ship to South America, they ship to the US, they ship to Europe. So you may be able to get some very compatible supplements through them. So there's lots of different ways, and really reach out to the Apollo team so we can help you.
And I would add, we train over 2,000 practitioners in 10 different countries. So there are excellent groups in Australia, Japan, South America, Mexico. So, all over the place. And you mentioned, of course, in Europe. So there are many, many people out there that are doing the right things.
Yeah, and we have some international clients that work with through telehealth practitioners and coaches in the US. So it's all possible, which is good news. This question's from Nancy. She's working with a neurofeedback therapist to amplify alpha. Any comments?
To amplify alpha waves, yeah. I mean, certainly neurofeedback can be helpful, but it's not just about amplifying alpha. I mean, I think the electrophysiology has been very helpful to give you an idea where you stand. And so, you want to know what your theta beta ratio is. You want to know what your dominant alpha rhythm is. You want to know what your P300 is. Are you responding to a rapid change, as we've heard recently from the NeuroCatch group, also your N400. So I do think that electrophysiology is helpful, and certainly, yes, working with neurofeedback is one of many things. And I would put it along with what we talk about as brain stimulation. in this case, a very specific type of brain stimulation and entrainment and support.
Great. I got a couple for you, Dr. Hinden. Someone is saying they have both sleep apnea and they have a CPAP for that, and TMJ, and they wear a mouth guard. What is the danger from bacteria from these devices causing us harm?
Well, the mask from the CPAP should be changed like every 3 or 4 months. And if you're on Medicare, then they'll change it for you. They'll just call your provider. They'll just give you a new mask. But it should be clean. They had these machines that were ozone generators that you put the mask in, it cleans it. They found that not as effective as they thought they would be. And the oral appliance, when you brush your teeth every morning, you just brush the appliance. It's the same thing you're doing to clean your teeth. You just want to make sure that you do it every day. But the mask should be changed every 3 to 4 months.
Great, thank you. From Margaret, this is still for you, Dr. Hinden. If you have a mold infection, should you wait till the mold is cleared before doing oral cavitation surgery?
So I think we should talk about doing oral cavitation surgery. Oral cavitations are supposedly when something doesn't heal properly. And it's not necessarily bacteria, but the bone doesn't heal properly. That before you do surgery, period, you should be healthy before you do the surgery. And what happens is when you do surgery and there's not a good blood supply, you end up with dead bone in the area that becomes a cavitation you have to clean out. So if you're doing surgery and they use a lot of vasoconstrictor, epinephrine in the anesthetic, that'll constrict blood flow. And so we try not to use it when we're doing surgery because, yeah, there's going to be more bleeding, but we want bleeding in the wound because things tend to work better. The same people who end up with cavitation have other things going on. And so what happens are people who've had cavitation surgery is done multiple times, which is like you keep repeating the same thing over and over and expect to get a different result. So if you need to have surgery, you want to make sure that you do it maybe without any vasoconstrictor or minimum amount of vasoconstrictor, and you give things that promote healing and get people off sugar, before they do the surgery. And if there's a chronic problem, maybe you want to wait until you get the body healthy before you do the surgery in the first place.
Yeah, great, thank you. Whoever wants to answer this is fine. From Linda, are you familiar with Dr. Peter Attia's book, Outlive, and how does our work dovetail with his recommendations?
Yeah, absolutely. And of course, Dr. Attia is a surgical oncologist who's interested in lifespan. His approach is a little different in that he's focused more on the heart. And so he's very interested in getting your lipids down very low, which can be an issue for your brain. The other thing is he hasn't published anything to say what he's suggesting actually was done in a trial and helped anybody. So we're focused, as I mentioned earlier, on best outcomes. We're publishing our data. We've published over 230 papers from our laboratory data leading up to this. We have proof documented over 100 on 100 have been one paper. Then recently the trial. Now we're doing a larger trial. What Dr. Attia is recommending is basically reading some literature and saying this is what looks like the right thing based on the data from other people. We're generating the data, publishing the data, and proving it. So there is a difference in that his focus a little bit more on the cardiovascular side. We're focused very clearly on the cognitive side. Now, in a perfect world, of course, those are all going to work together. But I think that's still been an issue where some cardiologists, for example, will be pushing for having very, very low lipids and low at the point where it may not be optimal for brain function.
Thank you. Here's another one for you, Dr. Bredesen. It's from Carl. he's curious if you've in-house trialed low-dose methylene blue with red light therapy on your patient population. This is coming from the work of Dr. Francisco Gonzalez Lima at UT Austin, where all the biohackers got the idea to use it from.
Yeah. So we actually had him at one of our brain board meetings, and he talked about the approach, and certainly, yeah. I mean, I think there's a lot of interesting potential for methylene blue. I actually think it has more theoretical potential in Parkinson's than it does in Alzheimer's, because it essentially provides a way to circumvent complex 1, which is the issue in Parkinson's. Having said that, of course, I know that he believes that it has important potential for Alzheimer's, and perhaps it does. The original testing done on it failed for Alzheimer's, but that was one trial. We'll see future trials. Again, it's so important to generate the data and to show, yes, does this help? Does this not help?
Great. From Kevin, with photo biomodulation, one hears of much positive feedback. Yet, how concerned should we be using photo biomodulation with known or unknown cancers?
Yeah, sorry, could you read this again? Because I'm not aware of photobiomodulation as being a problem for cancers. If anything, it's helpful for people use it for multiple things. It's been helpful, for example, for macular degeneration. Clearly, as we talked about earlier, in the right setting, helpful for cognition. So what's the concern here?
It's just a question on, is there any concern with cancer, known or unknown? It sounds like not, is what you're saying.
I'm not aware of photobiomodulation as a concern for cancer.
Yeah. Well, I hope that's helpful, Kevin. And if there's something specific, you can, type it back in.
Yeah, if there's a specific reference, happy to look at it.
Okay. What role does head injuries in childhood due to CPTSD play in brain health?
Yeah, so as we talked about earlier, this is about energetics and inflammation, and there's no question that any head trauma at any period of life can increase risk. And of course, virtually all of us have had some degree of head trauma, whether it was from playing baseball or volleyball or getting in a little car accident or falling off our bike or whatever it is. So virtually all of us have had some degree of head injury at some point. But there's no question that as you have more severe ones and as you have a higher number, there was a study a few years ago where they just did, just minimal head injury, but repeated, and it clearly increased risk. So this is, of course, in animal models. So there's no question that these things can be, and I would go beyond just head injury. ACEs, childhood, childhood trauma, mental trauma, stress, all of these things can be contributors. In general, when the major thing is trauma, we tend to see a triad of aggression, depression, and dementia. So the classic story is, someone was a football player and then they beat up their girlfriend or their spouse. They got very depressed and they may have committed suicide. And that's the sort of thing that you have. But there's no question, and that's why we have type 5, which is traumatic cognitive decline.
Yeah. So this one's for the Julies. It's from Mary. And she says in the last few weeks, she's revised her normally keto-like diet by eliminating carb snacks, non-gluten toast with lemon curd. I don't feel hunger like previously, but I'm also losing weight, 6 to 7 pounds in the last 3 weeks. I know this is a common thing that comes up. So suggestions?
Yeah, lots of times when people cut out what we like to call the just say no foods, which are sugar, simple carbs, grains, and conventional dairy. And then they're not substituting those calories by using enough dietary fat. I think it's been ingrained into a lot of people to watch their cholesterol and, stay on a low-fat diet Lots of folks are nervous about that. So you cut out certain foods, you begin eating whole food, plant forward diet, and you're just not using enough healthy fat. So one of the first things we encourage people to do is to use more healthy fats. We love high polyphenol extra virgin olive oil. In research, it's been shown to improve the brain structure and function, and it actually has been shown to improve cognition. So if you need an excuse to add another tablespoon of high polyphenol extra virgin olive oil on your vegetables, that's what I want to give you. Another thing, avocados, wonderful source of good heart healthy fats, also rich in fiber, nuts and seeds. And if your glycemic markers are good, your HbA1c and your fasting insulin, you can add more resistant starches as well. The last thing we want you to do is to become underweight, because that actually puts you at risk for cognitive decline. So it's super important to maintain a healthy weight.
Yeah. Anything
And
you want to add,
Julie? Yeah.
Coach Julie?
Yeah, I think the things that I usually work with my clients on are to make sure that they're getting enough food, like Julie G said. There is a great macronutrient calculator on the Apollo site. And if you go through that, you can figure out, how many calories do you need per day? And then what should your macronutrient breakdown be? And then if you have the ability to use chronometer.com or the chronometer app on your phone, you can plug in a couple days worth of food that you're eating and just see how close you're coming to that target that you've calculated. What happens when a lot of people, get rid of the carbs in their diet and they're eating healthy vegetables, which is fiber, that fills you up, the fat fills you up, you don't feel hungry, and you literally are eating less. I almost want to say you can forget to eat because you aren't hungry. And so it's important to make sure you really are giving your body enough calories to keep going at whatever level you're exercising and that sort of thing. So that just a few days worth of entering your food can be very instrumental in helping you figure out if that's the problem and you're just not eating enough. Every once in a while, you'll run into somebody who's not absorbing well, and you can eat a ton of food, and if you're not breaking it down and absorbing your food, or if you have something like SIBO and the bacteria are eating your food before you do, you can lose a lot of weight. So it's important to rule out any gut issues as well. But in general, I think people just eat less because you lose that hunger and you lose that craving of the foods that used to fill you up. So.
Yeah, thank you. So we haven't talked about this yet. So I'm skipping around certain questions. What are Dr. Bredesen's thoughts on women using hormone replacement therapy as it relates to the protocol?
Yeah, and I'll apologize here. I've got to sign off very quickly here. Let me just see if I can get back here too. So this is a very controversial area. We talk about this. At virtually every town hall. Dr. Anne Hathaway is a real expert in this area, and I would defer to her. And I know she's not on this particular Zoom, but she has pointed out that people definitely do better with BHRT, bioidentical hormone replacement therapy. There are estrogen receptors in the brain. There's also testosterone. These clearly support learning and memory. And so it's an important area. However, we recognize that there are associations with breast cancer and with hormone-sensitive cancers such as uterine and breast. And so you really need to work with an expert like Dr. Hathaway to decide when to do this, what's optimal. For those who have concerns because of, for example, previous cancer or family cancer risk, we recommend do the other parts of the protocol first. See how things are going 6 or 12 months in, and then maybe you don't need to include BHRT. There's also an issue about what age. And so the optimal, of course, has always been around the time of menopause. But Dr. Hathaway again points out she has achieved better results even in people who are older. So again, this is a very controversial area, and I recommend talking to someone who is a true expert like Dr. Hathaway.
Great. Well, Dr. Bredesen, how much time do you have? Should we look at wrapping up with some closing comments from everybody?
Please keep going as long as you like. But I've got to run, and I apologize. I'm on the road here, so we've got to run. But please keep going. I know there are lots of great questions, and let's all keep on working to reduce the global burden of dementia. And thanks again for
Thank you so much.
Who saw the film. Thank you very much, Christine. Take care. Bye-bye.
Bye-bye. All right, guys. Well, we are going to just do our best here. We have some good thinkers in the room. So there's several for you, Dr. Hendon. I'm going to pull a couple of them here. So one from Carl. A couple of people were asking about coconut oil pulling. And he's specifically asking using a good powdered vitamin C as mouthwash. And then your thoughts on Dr. Nathan's work on nitric oxide and in the mouth, if you're familiar with it.
Okay, so nitric oxide, the value is that it's a vasodilator, increases blood flow. One of the most important things you can do to increase nitric oxide is to breathe through your nose. That when you breathe through your nose, there are cells in the nose that produce nitric oxide. When you breathe through your mouth, you don't get that benefit. And so we try to encourage especially all our kids, all the children who are our patients, to establish good nasal breathing. And part of all the therapy for airway that we do is to encourage nasal breathing. Even doing lip taping sometimes is better, but it's not to seal off the mouth. Actually, the best way to do is place the tape vertically so you can breathe if you have to. It's really behavioral modification, not seal off your mouth so you can't breathe through your mouth. So that would be good. Things like oil pulling, vitamin C, rinses, they're all valuable. But going back to what I said before, if you haven't changed the terrain, as soon as you stop doing the treatment, things are just going to go back to the way they are. Because whatever is in your mouth is related to what's happening in the rest of your body.
Yeah, great. I think this is a quick one, but can chewing 100% xylitol gum help with getting rid of bacteria in the mouth?
It can reduce the bacteria, and the benefit of xylitol, it doesn't make your mouth as acid as sugar does. But it's much more effective if your mouth is alkaline to begin with. And it's what's really great is chewing xylitol gum has helped children reduce the rate of ear infections because the bacteria doesn't travel up the eustachian tubes to the ears.
Got it. Great. So this is one that I think Julie G from Jana. I am APOE4 homozygous. How does that impact what I need to be doing? And is the high fat diet safe for me? This comes up a lot.
That's a really good question. I'm also an APOE4 homozygote. And the answer is the diet is just fine for you as long as you minimize saturated fat. APOE4 carriers tend to hyperabsorb dietary fat, but it's especially saturated fat. So if you stick to the heart healthy fats, the Mediterranean fats, the high polyphenol extra virgin olive oil, the avocados, nuts and seeds, fatty fish, olives, I think you'll do just fine. I think I'm genetically blessed in some ways because I always have perfect lipids, even though I eat a really high fat diet. So it's absolutely possible. I know some APOE4 carriers really struggle. So go ahead and make sure you test advanced lipids at least once annually. But yeah, we found that the diet works great for those with 2 copies of APOE4.
Great. There was one about reconstituting microbiome. Someone with knee replacement, this is Julie E, says she needs to take prophylactic antibiotics every time she goes to the dentist for even routine visits. And she's wondering how best to reconstitute her microbiome.
So when you go to dentist and you have to be pre-medicated, you take basically 1 mega dose of antibiotics just to protect bacteria from getting into your system, and then just have good probiotics and at the next meal. And that'll be okay. It's also a good idea to try to coordinate all your dental appointments into few as possible, so you don't have to go on antibiotics for multiple visits. So if you have to, maybe ask your dentist, all right, can I have everything done in 1 to 2 visits, and maybe have them within a couple of days of each other.
Great. Another one.
I saw a question, and I don't know the answer to it, about somebody was wondering about, does insurance cover any of this at the present time? Because
Mhm.
you know that.
Yeah, Melody was asking about that.
With all the problems people have facing the financial burdens of doing the testing could be an obstacle.
Yeah, so the answer is yes, and not all insurances. But if anyone wants to elaborate on that, one of the Julies, because you probably have some more experience with this.
I'll start, but I'm sure you, Julie, have great information here. It's wonderful if you can work with a practitioner who will run as many tests as possible through your health insurance. So that's a question to ask while you're getting to know your doctor or while you're picking your practitioner. My practitioner does run many tests through my standard insurance. Otherwise, another good thing you can do is set up a health savings account. So that'll end up saving you 25–30% right there. So if you just take a little bit of money out of each paycheck, and when you need to pay for tests that aren't covered by insurance, that certainly is handy. Another thing, our ultimate goal is to get the entire protocol covered by Medicare, and we are actually working towards that now. So I'm sad that Medicare doesn't cover everything now, but we're very hopeful that this will be the standard of care soon, and that Medicare will be covering it. And Julie, I'm sure you've got great information.
I think you covered a lot of it, Julie. Certainly there are ways to get labs covered if you order them through a doctor who will order them through insurance and get the insurance to pay for it. And different insurance companies are different. Even some of the more advanced labs, like the mold labs, I know one of them is covered by Medicare and one is not. So it's always good to, if your practitioner is doing a mold test on you, you might ask them to stick with the real-time labs test, because they do have some Medicare coverage if you're on the Medicare program. There's, you can get the labs run through Apollo Health. That's not covered by insurance. It's fairly affordable though, probably paying less than you would if you were just paying completely out of pocket going through your doctor. And yes, it's unfortunate that a lot of the best functional medicine doctors are not reimbursable through insurance, but they're going to spend an hour, 2 hours, 3 hours with you at every visit. So it's not an 8-minute visit, and this is a complex protocol. So it's, unfortunately, I understand why they aren't reimbursed, or why they can't work through the insurance program, because they would never make any money. But it's hopeful in the future that this will be coming. And a lot of the things on the protocol are nearly free. So, testing, certainly, doctor's visits, those are important, especially if you have contributors that require prescriptions or, pretty heavy duty treatment plans. But a lot of this you can do yourself. And I just heard somebody was working on, comparing a whole foods diet to a packaged foods diet, trying to prove that it's actually less expensive to eat organic whole foods than eating a lot of, highly value added processed foods. So, I encourage you to look for ways to save money, start a garden, things like that. So there's ways to do this.
Yeah, so Mary, I see your follow-up question about Kaiser specifically. I would suggest this, contact support at ahnphealth.com, because our support folks are familiar with our practitioners and which insurance plans they take, and can dig into that for you. So that's what I would suggest for you.
And I found that if something's different, they'll always deny it. You have to be take charge of your health and fight for in order to get things improved. And it may be that if 10, 100, 1,000 people begin to question it, they may reconsider it. That, and maybe getting the CEO of a big health insurance company to go through the Bredesen protocol himself and get the benefits. That'll probably make
I like the way you
things a lot
think.
quicker.
Yeah, for sure. Yeah, a little personal experience. So Guy has a good question to zoom out with. How important is ketosis, and what is the best way to test breath or urine? Well, and I would add, or.
That's a great question. The importance of ketosis probably has to do with a lot of different things. Your age, your ApoE4 status. And the reason that I say that is that ApoE4 carriers tend to show this reduced uptake and utilization of glucose starting at a very young age, even in their 20s. So getting into ketosis at least once daily is super important for ApoE4 carriers. We want folks to get a beta hydroxybutyrate level of somewhere between 1 and 1.5 is usually good for a lot of people. If you find your cognition does better with higher levels on a more sustained period, that's fine. You can increase them. But everyone who's showing symptoms of cognitive decline is having trouble effectively using glucose in their brains. So for that reason, we do encourage folks to get into ketosis, and ideally natural endogenous ketosis, by combining our diet with a fasting period and exercise. And this not only will help heal your metabolic health so you can more effectively use glucose, but those ketones can serve as an alternative fuel as well. So the goal isn't chronic ketosis. The goal is metabolic flexibility, to reteach your body how to effectively use glucose and to also create ketones. So that was a long answer, Guy, and I apologize. And it's really complex. We could spend a whole hour on that.
Yeah. The questions have been outstanding and have shown like some depth of already understanding a good part of this. I can tell we have practitioners in the audience as well. We really need to wrap up. We've realized time has flown and we've been with you for 90 minutes. So I recognize there's a few questions we didn't get to, but we got to most of them. And I just want to invite the panelists to just make a closing comment as we close out today. Dr. Hinden, do you want to start?
Yeah, so I've had the great pleasure and privilege of being on 2 webinars this week, and what a great community of practitioners, coaches, and people are really taking charge of their health. So exciting to see that, and just keep it up. You're doing great work, and I'm here to support you any way I can.
Great, thank you. Julie G.
Yeah, I mean, it re-inspired me to watch this film. I'm excited about the protocol because it saved my life, but watching this film just reignited my passion around all of this. I just want to let everybody know that it absolutely works. It may not be easy, and just do your best. Health coaches are our most important secret weapon, I like to say. So if you're having trouble sticking to the protocol, consider working with a health coach. But please, I'm just here to tell you it works and there is hope. And Alzheimer's is not a progressive fatal disease as long as you begin the protocol early enough.
Beautiful. And Julie Luby.
And Julie G took some of my thoughts. I loved the movie, and I'm always so touched by the hope that this program offers and that was shown in the movie. And I loved that it was also balanced in that the filmmaker didn't make it seem like this was a slam dunk and it was something easy to do. So as you get into it and as you're trying to do it, remember that you need support, and remember that it kind of takes a village to help you through this. So reach out to the people who are around you who can help you. Find that exercise buddy. See if anybody else in your family will eat with you like this, and build your care team. Find that good practitioner, work with a health coach, work with a nutritionist. All of those people can help you do this protocol and make it easier for you to see improvements and to actually feel better and have your brain work better. And that's really what we're looking for, like Dr. Bredesen said, is those great outcomes.
Yeah, absolutely. Well, thank you all the panelists for spending your time today. We so appreciate you and your responses to this community that came on with such curiosity and wonderful questions. So this will be available on our YouTube channel soon. So if there's something you missed and want to go back and check it out, we invite you to do so. So thank you, everybody, and we're going to go ahead and sign off. Bye-bye.
Take care.